Hello, my name is Brad Bengtson, plastic surgeon at the Bengtson Center here in Grand Rapids, Michigan, and just honored to be here with Terri DeBoer. Today, we're having a Rejuvenate and Refresh event, and it's of the face. So I guess you can rejuvenate a lot of different areas that we do, but we're going to be talking about the face today, and just really excited to have Terri here and really just kind of chat about her journey, just her beauty journey since we first met. So
yeah, for a little more than a decade now, I've been a patient here at the Bengtson Center, and I know Dr. B, you and I have become friends through my work in television. I worked in front of a television camera for the better part of 40 years.
Wow.
And as a woman aging, we know that making sure that we continue to have a youthful appearance is super important. And so as we became friends, as you became a frequent guest as an expert on 8 West, and then as I eventually became a patient of yours, I really came to understand that it really is a continuum that we have to look at in terms of a journey when we think about maintaining a youthful appearance in a way that looks supernatural.
Right. Yeah, it really is it's an interesting experience just to what we call join people on the journey of their kind of beauty journey through life. And it's really interesting because your concerns and that kind of change over time, and also being on TV every day, it really kind of limits some recovery things. And so as we're planning different things, events, non-surgical and surgical procedures, we have to be, cognizant and careful about all of that. So I always, think it's really important to talk to patients three-dimensionally about their skin. I think it's the largest organ of our body, but it's the most neglected. I think it's kind of out there. And so when we look at the face in particular, we look at the surface, and then we look at wrinkle lines, and then we look at the structure. So what's really interesting is just looking back on your journey, you kind of started on the surface, so like skin care, those sorts of things, and then evolved eventually into wrinkle lines, skin tightening, and then eventually into structural, changes with actual surgical procedures on the face and neck. So maybe tell us a little bit about that journey that you had.
Yeah, so in 2012, as I was getting ready for my son's wedding, we started to think about, would this be the time that maybe we would do something like a laser treatment? And so Ultherapy was, at that point, something that you thought really could give me some good results.
Yep.
And it was really terrific, almost zero downtime with that. I mean, that was kind of one of those, we had it on a Friday afternoon, and by Monday morning, I'm back on television at work. And then what I really appreciate about the laser treatments is the fact that you go through the treatment, and then it is a progression. Almost week by week, I could see that my skin was getting tighter, and it really seemed like everything was lifting up, and I was getting a much more youthful appearance as time went on.
Yeah. So I always talk about Ulthera. We have new SoftWave as well, which is kind of Gen 2 technology for skin lifting and tightening. It really just kind of sets the clock back, so nothing really stops aging. Surgery is our biggest kind of tool in the toolbox to readjust, just the age of our face and those sorts of things. But the non-surgicals are also super effective, and I always tell patients that, just turns the clock back. I get it done every about 3 to 5 years, something like that. Just trying to kick the can down the road a little bit more before I actually have surgery. So, but those are really effective. And then also maybe just comment about skincare. So I kind of think a little bit, it's like going to a dentist. So we have to go to a dentist to get teeth cleaning and, do different things, but also we have to take care of our teeth and our face every day. So it's also, things that we can do to kind of keep up. And there's definitely a difference in medical grade, skincare versus just standard, back counter stuff. So
Yeah. So, for me, I always appreciated that as the approach that you took, because you said we have to start with what are you using on the surface of your skin? Are you making sure that it's clean? Of course, in television, you wear a whole lot of makeup, and making sure your pores are clean, making sure everything is at the end of the day back to allow your skin to breathe while you're sleeping at night, making sure you're hydrated, all of those sorts of things, just to really make sure that your skin as an organ gets the best opportunity to be as healthy as possible.
Yeah. So when patients come in and their concerns are mainly facial laxity, particularly jowling and extra neck skin is really the main two areas and stuff that we look at. So it's really interesting when you look at my practice like 25 years ago, our average age was probably 55, 60 years old. We'd be taking, 2 inches of skin off each side of the neck. I mean, it's super dramatic. And now, as time goes on, it's younger and younger patients, that are coming, and less and less surgery. So there's a lot of terminology out there about like a mini facelift or modified or whatever. I don't look at any surgery as mini. I think it's, it's a surgery, and it really just depends. Trying to get the time involved to the surgical schedulers, like how much time we're going to need to do that. So it can be just a little, minimal jowling, minimal skin, and it takes, about an hour per side. Or it can be, a lot of skin, just more advanced. So it's variable, but it's still just a facelift or neck lift. So, and then, I think that different concerns different patients have, if they come in and it's very early jowling, then like with Terri, we can do some non-surgical things. Some of the new technology we have, again, soft wave, we talked about. So looking back at your notes, I know you've had Profound, which is a microneedling radio frequency combination. So again, more of a surface focused technology. We have a new Matrix RF, which is also microneedling and RF, or heat applied to the needles, and just advancement in technology where the needles are smaller, you have less swelling and those sorts of things. So, but the results are really super consistent. So I think most people have had or know about microneedling and things. So again, those are more surface related things. But when you come to the point where everybody eventually does, usually, whether or not they do anything about it is different, but, just kind of coming consistently back, just getting to the point where, okay, I think I have enough skin that I really need to, do something surgically about it. Then we have those techniques now available surgically, and just the advancement of the tumescent and the different things we spoke about that just make the procedure, the follow-up, reducing complications, and everything just speeds everything up. Just the technology is just really light years where it used to be, and it's just super exciting now to bring patients through that. So.
And it is interesting because, as someone who spent her professional life in front of a television camera, I was always really self-conscious about my appearance. And now for almost everybody, you spend a portion of your life in front of a screen. Maybe it's Zoom for work, maybe it's social media, all those sorts of things. And so you really look at almost everybody as a mini celebrity in their own universe. Yeah. And so for someone in their maybe late 20s, 30s, early 40s, looking at the laser options just to make sure that they're as tight and fresh as possible. And then as time goes on, that Profound treatment, I think, was a real game changer. Yeah. I think for me, that combination of the heat and the microneedling probably pushed my facelift back by about 3 to 5 years. Yeah. Yeah. And so I would just encourage anyone who is in any way thinking they need to look more youthful, fresher, tighter, less tired maybe, that any of these treatments really could be a game changer for your overall personal presentation.
Yeah, and we just individually evaluate patients, and they come to us with their concerns, and we come to them with different options and stuff like that, and present all those to patients. So we have certainly a lot of new technologies and techniques that we can do. And then when you get to the surgical point, then you can really have the confidence that, like, hey, the techniques now are so much better, the recovery's faster, complications are less. It's just a real different scenario than it used to be. So.
I think that a lot of people are reluctant to prioritize how they feel about themselves. And, when we look good, we feel good. And when we feel good, we're able to be our very best. And so I would just say, don't look at this as being just a cosmetic investment that you make with your time and with your resources. Look at this as an investment that you're making in the quality of your overall life. And so for me, I think that along the way, going through the first step with the lasers, going through the microneedling with the heat and the profound, and then eventually going into the facelift, I can't tell you the difference that it has made in how I feel about myself. So funny little story for you. So I graduated from high school in 1983.
Wow.
So I went to my 40-year high school reunion.
Oh, wow.
And you could not believe the people who were coming up to me saying, how do you look so great?
Yeah.
And I said, well, I guess it's just good living.
Genetics and good living. That sounds right.
Yeah. And then I did break down and tell a few of my closest friends, but still, it was, for me, I felt so good about how I looked.
So as we're approaching your surgery day, kind of advancing through, it's kind of funny. Every time I saw you either out in public, it's like, okay, it's going to be this year. It's going to be this year. So I'm just like, waiting, and finally coming to the office and, okay, I think I'm ready, I'm getting enough skin, particularly in my neck, that I just believe that the non-surgicals are just not quite cutting it. So maybe go through a little bit about some of the fears you had and concerns, just kind of going in and questions and stuff you had.
Yeah, that was really important to me. I mean, I remember that, every year, at the beginning of the year, you start thinking about what is it that I really want to accomplish. And in 2024, November, I turned 60 years old, right? Okay. And so as I look, big one. Yeah. Although thanks to you, people are like, you don't even look like you're 40. So thank you, Dr. Bengtson.
Yeah, exactly.
So as I was as I was looking at that, 1 to 2 year span, counting down to my 60th birthday, knowing that I really feel great on the inside, and also knowing that for women, and I don't know if this is true for men too, but when you get older, if you're carrying some extra weight, that tends to make you look younger. And for me, that wasn't an option. I didn't want to sacrifice having low body fat for having a more youthful appearance to my face. So as I was thinking about, when am I going to do this facelift, I thought, well, I need to go in for a consultation. So we met in your office, and you came in and you said, Terri, I really think that this probably is the time. You have stretched out this process long enough. But you were very honest, and you said, we're going to do this in a way that, number one, does not change how you look. Yeah. What it's going to do is really restore how you looked 15 or 20 years ago. And so as you walked me through your strategy and your philosophy, and really what the approach is that you believe is the right one for having a facial and neck cosmetic surgery, as you shared with me that, I just really trusted that was the right approach, because you said we don't stretch.
Right. Yeah, so it's really interesting, particularly in West Michigan. I think some patients come in and they're like, oh, I don't want a facelift. I just want a neck lift. And some are like,
that was me. I'm like, you got to get the neck and the chin.
Facelift,
So, the neck and the chin. That was my big area.
So So it really is kind of getting to what specific concerns patients have, and then, talking about what we can do to enhance or improve those. So when it comes to surgery, there are a number of different things that have kind of changed in the past, probably 10 years, 12 years, that make it much more exciting for me, because we can get patients through it with really exceptional, good long-term outcomes, but much faster recovery. And so I'm going to look through, I think that we took photos of you 1 week post-op. So, and when we have this presentation or this webinar, we'll show some of your before and afters and stuff. And I think we have one of you just 1 week after surgery. If not, we'll find a patient who's just a week out. So the first big transformational thing that we do is we put fluid underneath the skin that has some pain medicine in it, like a lidocaine numbing medicine, but we really use it for the epinephrine. So it has a very dilute epinephrine that shrinks all the blood vessels. And when I first started doing this procedure like 25 years ago, patients were very black and blue, very swollen. Took a lot longer to do the surgery just because of the bleeding and stuff. Now we put fluid in, and there is almost no bleeding. I mean, the main bleeding we get is right when we make the skin incision. But as we're doing the surgery, there's almost no bleeding. And so the epinephrine kind of isolates the little blood vessels, and we can coagulate or cauterize those before they bleed. And we see all patients back the next day. So patients come back, and it's well over 90% that have no bruising. I mean, minimal swelling, particularly thinner-faced patients. And that, then they're back a week later to get their sutures out and can kind of almost get back into, society. So that one thing, no more drains because there's no bleeding, much quicker recovery, less pain, less swelling. But that one thing that we do it just really transformed this operation. I don't know if you remember, that aspect of things, or how much bleeding or bruising you had.
I do remember I had absolutely I had absolutely no bruising.
Yeah.
And I had very little swelling too.
Yeah.
And I think that all of that was, it's the way that you walk patients through, not just the lead up to the actual day of the surgery, but then as you send patients home, and then that 24-hour appointment. I mean, all of that was designed to, in my opinion and from my experience, make it so that it was a really easy first 24 hours for me. And then you talk about that post-op time. I had taken almost 2 weeks off from work, not really knowing exactly what I was going to need. I had the surgery on a Monday morning, and by Wednesday of the following week, so less than 10 days after surgery, I was part of a huge community event with Tim Tebow, where I've got pictures I'll share with you that nobody would have even known that I'd had surgery. It was remarkable.
Yeah, that's cool. He's a cool cat.
He is a great guy.
I met him too. He's a neat guy. So, I mean, when you have patients that bruise more isolated bruising from the injectables than surgery, I mean, it really says a lot. So I think that's the first thing we do differently. The second thing is we used to make incisions up into the hairline, back into the hairline. It created alopecia or hair loss in the scar and kind of step offs of the scar, and kind of a big negative incisions in the front of the ear. Now we go beneath the sideburn, back behind the cartilage. So the incision is kind of back behind and hidden, and then back behind the ear in front of the hairline. So the incisions are much more well hidden. So when somebody's looking at you from the front or from the side, there's really no visible scar. So particularly in your line of work and profile, I think that's another thing that's really a big improvement.
Oh yeah, I had talked to some people, some friends of mine who had facelifts years ago, and they were just surprised. We were comparing, hey, look behind my ear, and they just couldn't believe that virtually invisible. Like you almost cannot see anything.
Yeah. Were you concerned at all about just like being overly tight or overly done? Because see a lot of patients, when I'm out traveling and stuff, and it's like, wow, I mean, it's so overdone and tight. And I think, some patients are actually looking for that, but in West Michigan, not so much. So.
Right. And that was, when we had our first consultation and you explained your philosophy and you said, I don't believe in just pulling it back. He said, I really want you to have a very natural look. And I 100% know that that's what I got. And most people have no idea that I had anything done. And I think that's the point, right?
Yeah, absolutely.
They think you look great. They think, I can't even tell you how many people, when I say, look, I'm turning 60, cannot even believe it.
Yeah. Yeah, the best plastic surgeries in patients you can't tell I've had it.
Can't even tell, exactly. They just want to know what your secret to the fountain of youth is.
Yeah. So, I think, and technically what's happening in surgery is we are lifting, there's a structure. It's a hard thing to kind of communicate, but I think the best analogy, it's not perfect, but you take a piece of chicken and put it on the counter and you pull on the skin, the muscle kind of comes with it. So there's a structure that covers the muscles of our face, and we basically elevate that in a separate layer from the skin. And so it totally smooths the jawline out. And the big thing it does, it takes the load off the skin, so the skin doesn't have to work to hold things up. A lot of plastic surgeons and non-plastic surgeons that do a lot of cosmetic surgery in the United States, they don't tighten that deeper layer, and they're relying on the skin to over tighten it to hold up those deeper structures. And so I think that's when you get kind of the pulled looks in the mouth and just an over tightened, sort of a look. We do take every millimeter of skin out that we can, because there is a little pent up elasticity in the skin. And so we need to take every millimeter to avoid that over laxity. And occasionally we'll come back and do some skin tightening and stuff in the areas a year or two later for patients that just want that little bit of extra tightening. But those are the things that are kind of happening in surgery that we're trying to, make a patient from minute one not look over tight or over operated, but very natural, but also getting a nice 90-degree angle to the neck, nice smooth jawline, all those things that we're trying to achieve surgically. So,
yeah. So obviously you arrive for surgery in the morning and you have, no makeup, your hair is wet, freshly, everything.
Yeah.
And my husband drove me, and it was nice for him because he was able to bring his laptop and actually work while I was in surgery and then during the recovery period. And so I had him here, but it wasn't a wasted day for him because he was able to be really comfortable here and still have an environment where he could work.
Yeah. We have a really cool men's lounge downstairs. One of my friends out in California kind of encouraged me to include that when we build our center, and it's really cool. I mean, it's really neat. The chairs are super comfortable. It's hard to get up out of once you sit down in it, but we have a laptop bar. Some of the patients for shorter surgeries will come in our surgical lounge, but a lot of male family members will go over to the men's lounge. So it's a cool experience to have. But tell me a little bit about our staff. I'm obviously biased. I think our staff are amazing, but tell us a little bit about your experience that day, and did you have a lot of pain post-operatively? Just that whole experience.
Yeah, I had almost no pain at all. I mean, it wasn't anything that like I thought it would be. Maybe in your mind, you figure I'm having surgery. I had anticipated having a certain level of discomfort. I didn't. What I love is that everything is just so private and so focused on the patient. I felt like I was almost in a Queen for a Day episode because you go in through the private entryway, you get all checked in, you get changed, you have a warm blanket that is all about making you comfortable. And then just having, first class anesthesia here to walk me through exactly what to expect from an anesthesia perspective, knowing that that individual would be there with you and your team inside the surgery suite as the surgery was being done. Then post-op, I don't remember obviously a whole lot of that, but I remember eventually getting in the car, going home, heading to bed. And then first thing the next morning, getting up and coming back here so that I could have my hair washed by one of your medical professionals to double check that all the sutures were doing okay and to make sure that I was feeling okay. And so for me, I think that was a really important piece of it, knowing that the very next morning I would be returning here and being evaluated by someone who knew exactly what to look for.
Yeah, it's nice. We always like to see facial patients back the next day. So just do a hair wash. Your hair's kind of sticky with some of the soaps and stuff we use, and just to check, make sure everything looks good. And then back a week later, suture removal. And how long did it take you to kind of like go shopping at Meijer or, get, like you said, you had an event about 10 days later, but just kind of re-engaging with life. How long did that take?
Probably within, less than a week. It wasn't that I felt like I needed to even hide out at home. I had friends that came over and hung out. I used the time as some really downtime away from everything.
Nice.
And and to know on the calendar, it was interesting because as I was planning for this, and I knew I had that Tim Tebow event, and I knew that was 10 days out from surgery, that I really wanted to make sure I could attend and that I would look good, be able to put on full hair and makeup. And just to know that I was able to do that was really fantastic. I think the recovery is just so much faster. The recovery is indeed so much faster than most people think.
I'm just thinking back. I don't remember that, so I'm kind of thankful you didn't tell me about that Tim Tebow event, that you had. So I always tell patients, I think 6 weeks is good before like weddings or any major things. Just thinking, but I remember seeing you on TV, and just obviously, how's that look? Doesn't have much swelling. She looks really good, and so that's super exciting. I can tell you from a surgeon standpoint, it's a little different when you have operating on high-profile people, right? So it's a little bit of extra adrenal gland tightening and stuff. But
well, we knew it, when my teammates on 8 West and people that I know and really trust and respect, and one of my former mentors said I would never go to anyone but Dr. B, and I felt the same. I felt so much confidence from the very beginning in you and your team here, and just knowing that I was in the very best place possible if I was going to have this procedure.
Yeah, good. Thank you for that. So Dr. Bengtson here, thanks for attending our webinar. And Terri and I are now going to go into a question and answer. So send us your messages, your questions. We're happy to answer any questions. And thanks a lot for attending. We really appreciate it.
Ask anything. I'm an open book.
Sounds great.
Here we are together live in the office. So happy to have all of you here with us too. I do want to encourage you to type any questions that you have in the chat room. Here's the thing. Dr. B and I can see the questions. You can see the question you typed. Nobody else can see the question. So as personal as you need to get, we will answer those for you. This is really a private opportunity for you to gather enough information to make the right decision for you.
Absolutely. Welcome, everyone. Thanks for sticking around. We already have some really excellent questions. Common questions are common. So one of the things that a lot of patients are asking about are facial fillers, toxins, muscle relaxers, Botox, Daxify, some of the different injectables and stuff we use, and the timing of those with surgery. So a couple different really important things that most people don't really understand. The first thing is that plastic surgery is a both and sort of practice. I think society now is becoming so polarized. It's almost like either or, everything's either or. And in plastic surgery, particularly with facial aesthetics, it's all and or both and. So we deal with things both at the surface, so like skincare lasers. We deal with different wrinkle lines that are more fillers and toxins. Fillers are for lines at rest. So I have a line coming across my forehead that I get injected all the time. So it's just a line at rest is for facial fillers, nasolabial folds, marionette lines, lips, commonly injected. Toxins or muscle relaxers are for dynamic lines. So I've had some recent muscle relaxers, so I don't create the 11 lines quite as much as usually I do. So, and then structurally is really more of the surgical things. So when you start getting jowling and extra neck skin, those sorts of things are more surgical. The second thing is that, so it's all of those things that really creates the best optimal outcome. The second thing is that I think people really don't have a good grasp of is the areas that we inject are not typically areas that we're operating in or elevating the skin in. So almost all the injectables are within the nasolabial folds in and kind of the central area. So we're not actually elevating the skin. So we put injectables in, so it's totally fine to have injectables before surgery, after surgery. 100% of facelift patients, I'm injecting something in their face at the time of surgery. So, and then we just follow up and those sorts of things post-op. So, so that's a super common question. And maybe Terri, you can just kind of comment on what your routine is with skincare and those sorts of things.
Well, so I do wear a lot of makeup, in the television industry. And so I make sure that I take really good care of my skin using the professional grade products. There really is a difference in how you care for your skin. And as you and your team like to mention, our skin is the largest organ in our body. Yeah. So we have to treat it as though we treat the rest of our body. So making sure that we drink enough water, use the right products, making sure we get enough sleep, but really just making sure that everything is clean and prepared at night. And you have some great topical products as well that go along to really make sure that you're continuing that tightening process.
Yeah, we do. And so again, like we mentioned in our discussion together, there are things that you as a patient can do every day as far as different products you can put on. And then there are things that we can do. So we've gotten a number of questions about some of the topical treatments. And so there's a lot of confusion about, what does a skin peel do? What does a laser do? Skin peels are typically lighter peels that kind of address the same thing that lasers address. And so it's not like right or wrong to have, any specific one. Laser technology is really taking over as far as the chemical peels because it's a little bit more controllable as far as the depth and what we're actually targeting. So, and now we can stack different lasers. So for instance, there's a question about crepiness of the skin. So if it's very fine crepiness of the skin, we can use a surface tightening ablative type laser, but we can stack that with a laser that targets blood vessels and pigment. And so you can have all that done at the same time. And so it's just, there's kind of a big trend away from skin peels, although we still do those, to more laser technology. But peels do really well in the hands and décolleté area and stuff like that, where lasers can create a little bit of irregularity or splotchiness. So,
and there are a lot of questions about exactly what did I have done, the difference between a complete facelift and maybe a mini or a partial.
Right. Yeah. So we don't do half a facelift, so we don't do like one half and then come back and do the other half. So there is a continuum though of surgery. So we're seeing younger and younger patients coming in with just some minimal jowling and some little bit of extra skin, particularly just underneath the jawline. And so with patients like that, you can do more of a mini sort of a procedure. I don't like the word mini because all surgery is not mini. I mean, it's either surgical or non-surgical. But if we're just elevating the jowl, the incision's shorter. And so we don't have to go all the way down, the neckline to get neck skin. And we're really really treating the jowl area in really cool ways and multiple layers and stuff like that. So But if you have, for instance, a lot of extra neck skin, then we have to go down, a little bit lower along the hairline to get out skin. Commonly, we'll take 2 to 2.5 inches of skin off each side of patient's neck. So with a patient like Terri, you saw her before and afters, it's probably more like about an inch, but it's a lot more skin than you really think. So we kind of modify the procedure based on what the patient's concerns are. And so there's not really like a mini approach for everybody or a major approach for everybody. It's kind of individualized per patient.
Yeah, and we're getting a lot of questions here about cost. What is the overall cost? And really the only way that you can identify what the cost is by coming in for a consultation. And because you're part of this wonderful learning opportunity, your consultation is complimentary.
It is.
Which is really nice.
Complimentary.
And that's a great starting point, because the entire team here, Dr. B will do the evaluation, come up with what is a recommendation for a treatment option. And then that very same day, you'll meet with someone who will outline all of the costs for you from the beginning all the way to the end. And I viewed this as an investment I was making in myself. And so for me, it was really the best gift that I could have given myself. I'll be 60 in just a few weeks. And for me, it was just one of those where I thought, moving forward, I want to look as good as I feel in this season of my life.
Yeah. I think it is, the way to look at it is as an investment, definitely, versus just a transaction or a procedure or something like that. It really is, it's really significant. And then I think some of the other, common questions are, looking at some other non-surgical treatments. So when you come in, we basically will gauge your treatment options on what your specific concerns are. So we'll line up the different concerns that you have with either non-surgical or surgical things. There are patients all the time that come in that I'm like, I just think you're too young for surgery. And
that's what you kept telling me.
Yeah,
you kept, so I would have done this 10 years ago.
Yeah.
Because this was always my trouble spot. I felt like my neck and under my chin area, that's where I really showed my age. That's a genetic thing that runs in my family. And there wasn't anything I could really do about it ultimately, except have the surgery. But between then, I had some minimal jowling at some points, and that's where the laser treatments really helped out.
So we can kind of stage that and evaluate that, based on what your concerns are. And we'll talk with you about all the different, types. Cost really depends on, how much time we're actually be spending in surgery. So the difference between a mini term that we don't like to use as much, it's really it's just less time. So it's a way for me to talk with my schedulers that we're going to need less time to do less surgery than, like a full face neck, where we're really, and are we going to do the eyes or not? I mean, so, there's a lot of additional things that kind of go into that, but we'll give you very specific, we can give you some general ideas, but it's not really helpful because, you may come in and actually not need, all the different things. So it really is best to come in for a consult, I think. Just takes about an hour of your time and get all your questions answered specifically. So I think that's the way to go.
Yeah, because it's customized for each individual patient, because we're not all the same and our goals aren't the same and our needs aren't the same. People are wondering, did I have residual swelling? I had no swelling. Did I have bruising? I had no bruising. I was really surprised about that, but you're sharing with me the approach that you take, which is something that you have developed, understanding the physiology of our face and our neck.
Yeah, it's really kind of modified. I think there's really nothing new that plastic surgeons can kind of take credit for. I mean, I'm a really big history buff, and you can find some really crazy things. Like, for instance, the first facelift patient was done back in the very early 1900s, and it was a Polish aristocrat, and she went to a general surgeon. I mean, they didn't have any plastic surgeons back then, And basically she's like, I hate the skin like right on my cheek and my neck, and I want you to cut it out. And he's like, I mean, I don't know how to do that. So basically she talks him in to taking out the skin of her face. And so that was the first kind of facelift type patient. So obviously the techniques and that have been really modified, some of the things that we, talked about, but the biggest advantages, the biggest kind of life-changing things have been putting epinephrine and fluid underneath the skin. It just absolutely eliminates the bleeding. And so we can see the little blood vessels, so it's much faster, and there's much, much less bruising, swelling in patients. All the surgeons, do a modification of that technique in our practice. So that, and I think the other thing that we do and really pride ourselves in is that Terri talked about is our goals are really for a not an overdone, over tightened sort of a look. For me, that's just a no-go zone. So we can do a lot of different techniques in surgery that avoid that over tightening, kind of stepped out of a wind tunnel sort of a look. And, that's just what the patients are asking for. And that's just, our approach is just more of a natural proportional outcome that we're really shooting for. So.
Dr. B, we're getting a couple of questions from patients who have reached that magical age of 70 plus.
Okay, yeah.
Is there an age where you say we maybe wouldn't advise that, or we would advise something different?
Yeah. So just off the cuff, I mean, I have done facial facelifting type procedures on someone in their low 30s. Just minimal sorts of jowling. Some patients just genetically, unfortunately, they just get, some extra sagging skin, or particularly younger patients that have had significant weight loss, like, massive weight loss patients, or 100-pound, weight loss patients in that. So age is not really a determinant. It's more your, physiological age versus your chronological age. One of my favorite movies was Raiders of the Lost Ark, and when she smacked him in the head with a mirror, she says, you really look like, what? And he said, honey, it's not the age, it's the mileage. And so, so it's really how much mileage you have. You can be a 90-year-old, 60-year-old, or a 60-year-old, 90-year-old. I've done facelifts on patients in their mid-80s that are just super healthy. And there are different ways you can do things to improve the safety and all that stuff. So, age is not a significant contraindication.
So we have one that's coming in also about eyelid surgery.
Mm-hmm.
We did not do anything above in the eye area and up, but is that something that typically you would do?
Yeah, typically, again, if you have extra eyelid skin, the issue with the upper eyelids is the first thing we check is your brow position. So your brow position is very good. It's kind of at the bone or above the bone. Brows in men are a little bit lower. So if a patient has low brows, then we're going to do soft wave, which is this new technology that we have that will lift and elevate the brows of the face. It also does it for early jowling and neck skin. I'm going to stick my face and neck in there in about another month. I'm trying to kick the can down the road, a little bit longer. So the first thing we do is evaluate the brow position. When everybody looks in the mirror tonight, if you grab your brows and lift them up even a couple millimeters, it does significantly decrease the extra skin you have in your eyelid. So we evaluate that, and then any extra eyelid skin we can take out at the same time. The lower eyelids is skin, but it's really more fat. And so you really don't have a prominent amount of fat in the lower lid. So generally as we age, there's a veil that holds the fat in. And as we age, that veil weakens. And so the fat bulges out. So we get some hill and valley shadowing effect. So the time to do eyelid surgery is definitely the time, to do it as you're getting your facelift done, mainly because it's much less expensive. You're already in the operating room. The recovery is the same. And, the eyelids are a one-shot deal, so it's just a once-in-a-lifetime sort of procedure. So it's not something you have to have done repetitively. So patients that have concerns of their eyelids, we definitely would recommend doing that all at the same time.
So what about men? Are you noticing more men are coming in?
Yeah, it's really crazy. With our hair transplant part of the practice, we're seeing more men. We do a lot of liposuction, breast reductions in men. The men are probably last we checked, about 19% of our practice. So it's really dramatically increasing. Yeah. And we actually have a lot of men that come in for fillers, Botox, Daxify, different, muscle relaxers, and even skincare. Lasers are really popular for blood vessels and that in men. So it's much, much more common.
Yeah, cool sculpting and all of that stuff too. Yeah.
Cool sculpting. Yeah, we definitely do. And just to mention, with every facelift, we always do liposuction underneath the chin. So usually there's little deposits of fat that are just underneath the chin. So we want to contour that at the same time.
Mm-hmm. Yeah, that was great. And people are coming and going into the chat. I know you covered this in the beginning. So let's talk again. Somebody who's had fillers and Botox, they still can be a candidate for plastic surgery.
Absolutely. Yeah. It's there's no prerequisites before or after. Again, we do a lot of fillers and toxins in surgery, and then you can follow up with me, or we have amazing aesthetic experts. I think we have 8 now that you can follow up with, and they can continue to follow you long term for all those procedures as well.
Yeah, and you do events here. I know you have some that are coming up, and it's a really great opportunity for you to come in and actually meet the staff and see this beautiful space here, and maybe do some early Christmas shopping for yourself,
absolutely,
or somebody you love.
Absolutely. We got a lot of gift cards and stuff too. We have some really interesting new technology called SoftWave. That's the lifting, tightening, non-surgical technology. It's similar to Ulthera, but it's like generation 2. The other technology we have, someone asked about Profound, which is basically microneedling that everybody's kind of heard about. It doesn't hurt. Any word with the word needle in it sounds painful, but it's actually not. Most patients will sleep through or can sleep through the procedure. So it's really not painful. But when you apply heat to the needles, it's much more effective. So Terri had Profound in her lower face, neck, and it's a good non-surgical technology. We are just bringing on a brand new second generation microneedling radio frequency technology called Matrix that we're launching, I think, next week. So there's a lot of non-surgical things, that again go hand in hand. Surgery wise should be like a 10-year result. But long term, we can talk with patients either about doing less of a skin removal because there's less skin that actually remains after a facelift. So the skin does stretch a little bit. A lot of these patients, though, are just coming back and we're just doing non-surgical procedures, post-operatively. So you can maintain, the outcome non-surgically in most patients. So.
Yeah, and the dates that you have coming up on the events.
Yeah, so we have a brand new associate, Nargis Horiat. So she's absolutely amazing, and we're super excited to have her on board. I tell everybody we had her on 8 West, and I tell everybody if plastic surgery had a draft, she'd be like 1, 2, or 3. I mean, she's absolutely incredible. Technically amazing. She's been working with Dr. Alfonso and I for the last 3 months or so. And so she's going to have an open house on November 7. And then she's also going to be giving a surgical webinar, just a general kind of surgical approach on November 14. So similar webinar format like we're doing today. And then December 12, we're actually going to have a SoftWave webinar, which is the new skin lifting tightening system. So always a lot of fun exciting new things coming. So
yeah, a lot of great events going on here all the time. And it really does start with education. And I just really applaud everyone who joined us for the webinar, because this is a great starting point. Start to get the information, really figure out what are the differentiating factors between Dr. Bengtson and the approach that he and his team will take.
Yeah.
Because I think the most important decision that we make is the team that we trust to do these procedures. Yeah. And I would not trust anyone more than I trust Dr. Bengtson and the entire team here.
Thank you. Just with one maybe final question. It's a real common question. I think is super important. Is, do you have your own surgical facility, or do you do surgery in the hospital? And first of all, your patient safety and overall safety of the procedure is our number one priority. So our anesthesia team, there are 15 incredible anesthesiologists from Corewell that come and rotate through to do all of our anesthesia. And we hand select the people that we work with. They're absolutely incredible technically, but also really super nice people. So I think they kind of fight to come out here. They think it's kind of a country club.
I was peppering the anesthesiologist with my questions before when I was doing my pre-op stuff. And I said, hey, do you love coming here? He was like, well, look around. What's there not to love here?
So,
but I do want to do a quick reminder to you. You'll be receiving a text message at the end of this event. If you reply with a smile, then we're going to be contacting you for that, to schedule with that complimentary consultation. And again, remember, it's complimentary because you are part of this educational event. Lots of folks wondering, they had to step in and out, missed some of the Q&A or maybe some of the video that preceded our live event. This will actually be provided to you as a link when we follow up with you from your registration information. So you'll be able to watch this and share it with friends, quite honestly. I mean, you probably have a friend or two that you're thinking could really benefit from this. And hey, maybe you do make a pact and you're planning for the new year and you're going to come in and have plastic surgery together as friends.
Sounds great. Sounds great. If you do have any other questions, just send those in to our staff, and we'll do our best to answer those. As Terri said before, the best thing really to do, though, is just take an hour out of your day, come in and meet with one of the surgeons here, just about you specifically, because we can really customize and evaluate your concerns very specifically. And we have everything. I always tell patients, if there's anything out there that works and safe and effective, we own it. So so we have all the different technologies and things to chat with you about. So
that's right. Yeah.
Great.
Well, good. Well, thank you again for coming. Again, we didn't answer every single question here, but we'll be following up with everyone and get you scheduled for that complimentary consultation. So
great.
Thanks for joining us tonight.
Thanks very much.